Hi, everyone. Thank you for joining. We'll get started here shortly. We're just waiting for a few more to join us, and I'll make introductions here in a minute. Thank you. All right, we'll get started here for the mid-year election changes webinar. Thank you for joining us. This should probably be pretty brief, and we will get you out of here. But if you have questions, feel free to submit them in the Q&A. If anything comes up afterwards, of course, you can email us or call us and contact your relationship manager. We have the relationship managers on the screen as well to get familiar with them. If you have not seen them, they're identified with their names. And if you have any questions, just let us know. We also have Kathy Yule on there. She's the Director of Relationship Management, Growth and Retention. We have Scott Muir, a VP of Flexible Benefits. Matt Gerard will be joining us shortly. He's the compliance attorney. And I am Kate Rader. I'm the marketing specialist, and I'll let Steve introduce himself here shortly. And if you need anything, just submit it to the Q&A. It's all yours, Steve.
Thanks, Kate. Thanks everyone for joining us today. Like Kate said, this should be pretty brief, so we appreciate spending a little bit of time with us. At MBS, I work on our business development team. I've been here for about 15 years, spent some time on our relationship management team, and recognize quite a few of the names of those of you that are joining us. And hopefully this will be beneficial for all of you. From the registration list that we got, we saw that most of you that are joining us today are in roles on the broker side or on a benefits team at your specific employer, working with us on an FSA, a POP plan, something like that. And we understand that probably in your role, you're getting a lot of questions from employees about mid-year election changes, especially this time of year, as most of you have ended open enrollment. If you were on a calendar year, now's the time when these types of questions start to come up. So our goal today is to help you understand just the basics of mid-year election changes. Some of what we're going to talk about today include just introductory types of things about mid-year election changes, what those changes are, why they're in place, the changes that can be made if you have an employee that experiences a qualifying event, Other considerations that you should be aware of when you're talking about mid-year election changes, then some commonly asked questions that we see come up a lot from your employees, from you and your roles that you're getting, that we hope to provide more information on, and then just some closing thoughts on the value of providing the option for mid-year election changes for your employees. So to get into the basics of it, anyone that makes an election that's an election that falls under a cafeteria plan or Section 125 is subject to those Section 125 regulations. And the guidance on regulations regarding changes is that once someone makes their election, after an open enrollment has ended, they can't make any changes to that election unless they experience a qualified event. These are types of events that the IRS calls permitted election change events. And in most cases, they're larger life events. Once an employee makes their election, they can't make changes just based off their own discretion. The types of things that would allow them to make changes are listed here. So as I said, they're larger life events. So birth of a baby, the loss of a dependent, the addition of a spouse, or in the case of a divorce, someone can make changes. And then other things related to maybe their coverage options that are available to them. So if they have a change in employment status, maybe the option to enroll in a new plan through a spouse or something like that, these would all be considered permitted election change events. When someone experiences one of these events, there are different types of changes that they can make, and that's also outlined in IRS regulations. The types of changes that are allowed are listed here. Examples would be that they can enroll in different health plans offered by their employer, or if a spouse's employer is entering open enrollment, that can often be a permitted election change. They can add or remove dependents from coverage. With an FSA, they can change their election amount. They can increase contributions, decrease contributions, stop contributing, and they can also terminate coverage for certain events. Some other things to keep in mind is that when plans allow mid-year election changes, they have to do that in accordance with IRS regulations and other guidance. So what that means is there's basically two things to keep in mind. First is a plan can't offer more types of events that would qualify for a change than what the IRS permits. The opposite of that is true, though. Based off the list of mid-year election changes that we kind of highlighted on the first slide, those are considered just kind of off-the-shelf types of election changes that if you're just drafting a plan document to include all types of eligible events, those are the types of things that would be permitted. But if an employer wanted to, they could narrow those down. They could choose to not allow certain types of election change events. So for example, if we think about some of those from the first slide, if they wanted to remove one of those, so maybe the option for new coverage, if a plan wanted to make it so that their specific plan did not allow that as an eligible change event, they could do that. Can't think of many reasons that an employer would want to do that, but we'll highlight the opposite of that, why it is important to include as many of these election changes in your plan as possible in an upcoming slide. Another thing to keep in mind when you're thinking about mid-year election changes is the change has to be consistent with the event. So an example of that would be if someone is enrolled in, let's say they're enrolled in a medical plan with two-party coverage. They cover themselves and they cover their spouse, and they have a baby, then you would expect that the change that they make would be consistent with that event, meaning that they would want to change their coverage from covering them and their spouse to now covering themselves, spouse, and also their new baby. So in order for that change to be consistent with the event, that's what they would have to do. They couldn't say, well, I've had a baby, I want to remove my spouse from my coverage and just cover myself now, which hopefully doesn't come up that often, but just an important thing to keep in mind, that based off the change that they experience, or the event that they experience, the change that they make should be consistent with that event. there is a lot of power in keeping or offering all the available mid-year changes that you can. It kind of shows that you value your employees as individuals who have life-changing events sometimes, have things coming up that they weren't expecting, or that if they had known about during open enrollment, they maybe would have made different decisions. So by allowing most of the mid-year election changes that you can, it allows you to adjust benefits to respond to life events, enhance your employee satisfaction and retention. You also have the opportunity to allow your employees to address gaps in coverage by allowing all these mid-year changes, and it's showing that you're taking a more proactive approach to managing your employees' financial well-being, because they are having money go towards these benefits, where if they have a change that permits a change, it's going to be financially beneficial for them to be able to make a change to whatever coverage they've elected. As always, you want to take a proactive approach to communicating how these changes work with your employees. A lot of times employees aren't even aware that if they do make an election during open enrollment, they won't be able to make changes to that after open enrollment has ended. So from an initial standpoint, just making sure that employees understand how these benefits work, that they are irrevocable unless they experience a mid-year change event. That's kind of the first key that you would want to keep in mind. There are a number of ways to do that. And one thing that we always recommend, and it's easy to recommend because it's a requirement by the IRS, is that you make your SPD, your summary plan description, part of your plan document package, available to your employees. With the plan document package that you have from MBS, that's going to include your actual plan document and then also the SPD. The difference between the plan document and the SPD is the plan document is less layman's terms, less everyday terms. The plan document often refers to specific sections of IRS code that your average employee isn't going to understand. They're not going to know what it's referring to. Your SPD has more language that your everyday employee is going to understand. So we do recommend making that available to your employees. First of all, and most important, because it is required by the IRS that you do that, but also because it's going to help them understand how your plan works, specifically mid-year election changes, and what events are going to be allowed for them to make a change if they experience one of those events. We do get some frequently asked questions from some of our clients that we've seen in the past, and we wanted to address some of those here. As Kate said, you have the option to submit your questions, and if you've done that now, or if any of these spark other questions, please do that, and we'll make sure that we address those at the end of the presentation. But just to highlight some of the more frequently asked questions that we've seen from our clients in the past. First of all, what happens with mistaken elections? And is it ever okay to fix an election due to an employee or employer error? An example of that we see pretty often is, what if an employee signs up for dependent care, but they meant to sign up for healthcare FSA as well? So there is guidance from different entities that are kind of experts when it comes to cafeteria plans and guidance that the IRS has issued. And one thing that we've seen is that there are other events that would permit an election change outside of those that we highlighted in the first slide. And those are things that are kind of related to administrative errors, whether that's an employer error or an employee error. As the plan sponsor, you are able to allow changes for those types of things, but there are certain things that you would want to keep in mind. The first thing is that if that situation comes up, so if there's a situation where it's an employee error or an employer error, the guidance that we've seen mentions specifically that there has to be clear and convincing evidence that it was in fact a mistaken election. So the example that we're using here, what if I signed up for dependent care, but I meant to sign up for a healthcare FSA? That can be pretty black and white in some situations. A lot of times when we see that, Maybe the employee doesn't have any dependents, they don't have any children, so it's clear that they couldn't have benefited by making the dependent care election. That's another piece of the guidance that we refer to, is it has to be clear that the employee couldn't benefit from this mistaken election. So if they don't have any kids at all, or they do have kids but they're not in daycare, it's pretty clear and convincing that it was a mistaken election, because if they're not incurring any dependent care expenses, it's pretty obvious that they probably meant to make a healthcare FSA election. And in situations like that, you are able to allow for changes. You could let that employee kind of move the election that they made from their dependent care FSA to their healthcare FSA. And we're happy to help with that. If you have seen situations like that, you would want to contact your RM, and we can kind of instruct you on the administrative steps that you want to take to make that happen. Other things that would kind of fall under that same category would be if it's like an employer error. So maybe an employee realized during open enrollment that they meant to elect a different type of coverage or a different benefit, and they instructed their HR team, their benefits team, that they realized they made a mistake. They're still in open enrollment, so they want to make a change, and for whatever reason that change just doesn't happen internally, and it's not discovered again until after open enrollment has ended. In that situation, if you do have kind of a communication trail that you can follow to see that the employee did realize they made a mistake, they notified us as the employer that they made a mistake, and then we missed something on our end, so we made a mistake, that's another situation where you can allow for changes. And then one other thing that falls under that same kind of category of administrative errors that allow for election changes is with non-discrimination testing. It's always recommended that you do a preliminary test with your plan in a new year to identify any issues early on in the plan year. If you do that preliminary test, which is something that we help with our clients, and you realize we're going to fail this test, this specific test, unless we make these changes, you are allowed to almost force your employees to make those changes during the middle of the plan year so that you can ensure that your plan passes testing. And that kind of leads into the next question listed here. What are the responsibilities of the employer when documenting mid-year election changes? So with mistaken elections, or with administrative errors, or with the list of just common mid-year election change events that we talked about initially, you just want to make sure that you are keeping some sort of documentation. So if there were ever an audit, you could show this is why we allowed the change. That documentation, if it's like an administrative error, it should be something where you're documenting what you have as clear and convincing evidence to show that it was a mistaken election. Or if it's a typical mid-year election change event, like a birth of a baby, you're going to want to get a birth certificate from the participant, not the actual birth certificate, but a copy of it, and keep that on file so that you can show that you verified that the qualified event did indeed happen. And then last, one question that comes up a lot is, are dependent care FSAs subject to the same regulations regarding mid-year changes? And dependent care FSAs are unique in the way that they do have kind of a more expansive list of things that would allow for a change than your other cafeteria plan benefits. With a dependent care FSA, an employee can make a change for a number of events. And what I've always told people when I've been asked this question is pretty much anything that would lead a person to want to make a change to their dependent care election is going to be considered a qualifying event for dependent care. So some examples would be, if someone takes a child out of daycare, they can make a change to their daycare election for that. The opposite of that is true. If someone puts their child into daycare and they want to increase their dependent care contribution, they can make a change for that as well. If the price of the daycare changes, maybe it goes up or goes down, that would be a qualifying event for dependent care as well. So some of the more common things that are going to happen to employees with children in daycare facilities, those things that would lead to them wanting to make a change to what they're contributing, are usually a qualifying event for dependent care FSA only. And if you have seen those, or if you experience those in the future and want to confirm with MBS if those are permitted changes for dependent care, you could again reach out to your relationship manager with specifics on the situation, and we could provide you with more guidance on that. So just to recap, that with mid-year election changes, it's not a free-for-all. There are specific events that have to happen. And then, as we mentioned, the change that happens after that event occurs has to be consistent with the event. We're always happy to provide guidance when these types of things come up. But as a whole, we see that most of our clients do allow all permitted mid-year election changes within their plan document. To my knowledge, we don't have a single client that restricts any of them, just because of the value that it adds to helping your employees when they do have a change in their situation that they weren't expecting. And again, it shows that you value them as an individual and you want to help them as these situations come up. That kind of recaps everything that we wanted to talk about today. So I don't know if we've received any questions, but I'll turn it back over to you, Kate, in case there are any.
Thanks, Steve. We do. We have a few questions here. The first one is, if an employee learns they are pregnant and they want to add an FSA with the birth of the child, could they add the coverage prior to the birth so they could pay some of the premiums beforehand?
Good question. Unfortunately, no. We wish that that's something that would change, because understand that that if someone finds out they're pregnant, then their expected out-of-pocket expenses are going to change from that day going forward. So we wish that that was something that would be considered a qualified event, but unfortunately it's not. Hopefully someday that will change, but as of right now, the only qualifying event related to a pregnancy would be when the baby is actually born. That's when they're allowed to make a change to their FSA election.
Okay, the second question, is a mid-year election a certain time of frame each year?
So with the mid-year election change, it's usually dependent on the event, and then as the plan sponsor, you decide how long the employee has to notify you about the change after it happens. What's most common and what we typically put in our plan documents, unless it's requested otherwise, is that they have a 30-day window after the event to notify you of the change. So the event can happen at any point in the plan year. It could happen 2 days after the plan year starts. But in terms of time frame of them notifying you of the change, that is up to your discretion. But unless specifically stated otherwise, your plan document is probably going to say that they have 30 days to notify you of the change.
All right. The last question, unless someone has some to submit, please do now. But what is the purpose of mid-year election if a qualifying life event is required?
So it's kind of the same thing. It's not a mid-year. It's not that they're making a mid-year election change. It's that they're making a mid-year change to their election. So you're not allowing just mid-year changes, mid-year elections for any reason. It's that you're allowing changes in the middle of a year to a person's election because they have experienced one of these qualifying events.
All right, we did get another one. As a best practice, how often should companies send out communications to staff on this benefit?
What we recommend is that you make sure that there's a communication that goes out about it during open enrollment. Just helping employees understand before they make their election that it is going to be irrevocable unless they experience a mid-year change. And then outside of that, it kind of depends on the type of employer that you're working for. In a situation where you're with a small employer and you have a better understanding of the events that are happening to your employees, you can usually address those on a case-to-case basis. So if it's a really small employer where you know everyone really well and you know what's happening and you know that an employee has a baby, You could reach out to them and say, hey, are you aware that you can make a change to these benefits if you need to? But a lot of times that isn't possible, especially with larger employers. So outside of making sure that employees are aware of things kind of before open enrollment, that we would maybe recommend that once or twice during the plan year, you do just send out communication to employees, letting them know what the eligible events for a change are and letting them know the process to make the change if they know that they're going to experience one of those in the future.
All right, we have a hand raised. I can allow for the question over the mic for Sherry Rich, if you can.
Yes, can you hear me?
Yes, go ahead.
I can't get my Q&A to work. So if an employee says that they didn't mean to sign up for dependent care and then they want to switch to an FSA, what do most people allow for the money? Is the money just lost that was applied to the dependent care? Or do you move it to the money that they did put in there? Do you move it to the FSA, or is the money refunded? How does that all work?
Good question. A change like that can be applied retroactively. So if you're certain that it was just a bad election from the start, then you could allow the change to happen on a retroactive basis. So what we would recommend most often in that situation is that anything that they've already contributed to their dependent care account gets moved over to show as a contribution made to their FSA. And you would want to handle that internally in your system. If you need to make updates in your system, also notify us at MBS so that we can work with you on how we move the funds on our side. So they wouldn't have to forfeit any contributions that they've already made. Those would just be moved over to the healthcare FSA and they'd be available for eligible healthcare expenses. I think the one situation that could come up is if someone made the maximum election for dependent care, so that maximum was 5,000. With the healthcare FSA, the maximum the IRS allows an employee to make is 3,200. So if they elected like 5,000 for dependent care FSA, but your maximum is the 3,200 and it's not caught until later in the year, and they've already contributed more than the 3,200, then at that point, anything that they've contributed above the 3,200 to their healthcare FSA, you'd probably want to get that back to them on a post-tax basis. And you could kind of work out with the employee whether you want to just refund everything back to them besides the 3,200, and then their deductions just stop at that point, or if you would want to figure out what they should have contributed at that point if their election was 3,200, refund the difference, and then set the contributions to go as what they should have been initially. But in those cases, an employee is not going to forfeit funds. There's always a solution where whatever they have contributed can be moved over to the healthcare FSA.
All right, we have a couple more questions. Someone asked if the PowerPoint will be available. We will send the PowerPoint after probably tomorrow with the recording of this webinar. So you will get both sent to your email. The next question, if an employee was out on a TDI/LTDI, do we have to require them to make a catch-up deduction, or are we allowed to change the annual deferral amount?
You can usually do either. That's something that if you contact your relationship manager with the specifics, there may be a case to allow for either. So an employee could change their election unless it would leave them with an overspent account at the end of the plan year. But in most situations, you can do either. You can just change their election to remove the contributions that they missed, or you can change their contribution so they still reach their goal amount by the end of the year.
Okay, well, it looks like that's the last of the questions. If something comes up, like I mentioned, feel free to contact us via email or call. And that's it for the presentation. So thank you all for joining us. Thank you, Steve, and the relationship managers and everyone for attending.
Thanks, everyone.